the center that's running the study. Angela directs the infectious disease research clinic, and she will be the one enrolling
All right, so the framing
subjects and
awful.
overseeing nurses and the sample.
Oh, perfect.
And that's
It says it's recording, so
my
we'll
lab will
stop
be the
recording,
immunology
right?
on the sample.
You're now unmuted.
Good afternoon. My name is Chip Partner. I'm Assistant VP for Communications at the University of Rochester Medical Center. I want to thank our friends in the media for joining us today. Today we're joined by two URMC researchers launching a study to understand how the immune system responds to the COVID-19 infection, which may help to inform the public health response to COVID-19, vaccine development, and decisions related to the reopening of the economy. The study will seek to recruit 100 people in the Rochester area who are COVID-19 positive and follow them for several months. It's being supported with a $5 million grant, $5 million funding from the National Institute for Allergy and Infectious Diseases, the institute that's led by Dr. Anthony Fauci. You should have all received our news release in the URMC newsroom and received B-roll of work in Dr. Dave Topham's lab. Here to answer questions about the new study are Dr. Dave Topham and Dr. Angela Branche. Dave is a professor of the URMC Department of Microbiology. Angela is an assistant professor in the Department of Medicine. Dr. Topham.
Hi, thank you. Yes, I'll do it in terms of introductions. I direct the New York Influenza Center of Excellence. That's where the funding is coming for this study. Angela is director of the Infectious Disease Research Clinic, which the Flu Center uses to conduct these clinical studies and trials.
And in the interest of time, because Dr. Branche has to join a conference call with NIAID at 2 o'clock, we will jump right into questions. I should say that the New York Influenza Center of Excellence, that's one of 5 centers of excellence funded by NIH nationally. And Dr. Branche, who's co-director of the Vaccine Trials and Evaluation Unit, that's one of 9 VTEUs nationally funded by NIH. Is that correct?
Yes.
And we're going to start with Diana Louise Carter from the RBJ, followed by Jennifer Lukey at WATC Channel 10. Diana? Diana, you should be unmuted. Should she hit *6? Diana, we'll come back to you. Sorry for technical difficulty. Jennifer Lukey at WATC 10, are you there?
I'm here. Can you guys hear me okay?
Just
Yes,
fine,
I
thank
can.
you.
Okay, great. Thanks for your time this afternoon, doctors. I guess if someone could just start just with an overview of exactly what we're looking at, what kind of COVID patients you wanted. Is it those who were acutely injured and in the hospital from the illness, or is it those who just tested positive and stayed at home? Who are you looking for, and what will happen to them in this study?
I can take that question. So we are looking for subjects who are acutely infected with COVID-19. We realize that not everyone who may have symptoms may go and get tested right away. It depends on the recommendations of their doctors or the urgent care hospital center that they might have visited. So even if they have symptoms, but they haven't been confirmed as COVID-19 positive, we're interested in those subjects. We're also interested in people who live in households with people who are known to be positive or suspected to be positive for COVID-19. And if I can, I'd like to just take a minute to let you understand the rationale behind that. So there's several questions we're interested in looking at. We're interested in understanding how your body's immune or defense system responds to an infection over time, and specifically how you develop protection against COVID-19 after you've been infected. But we're also interested in understanding how transmission may occur within a household. So for example, if a young child has an infection, will the rest of the household become infected as well? And similarly with an adult parent or an older adult parent. And we're also interested in understanding the rate of asymptomatic infection. We know based on some of the studies that have been coming out worldwide that there is a significant proportion of people who may be infected but may not have very obvious symptoms. And they may actually be the ones that are transmitting most efficiently because they're not aware they're infected. So we want to be able to contribute to sort of our understanding of how great that population of asymptomatic infection is, and really what the risk is to the public because of that.
Thank you, Dr. Branche. Jennifer, did you have a follow-up question?
Yeah, there's a lot of talk. The governor just a few minutes ago talking about antibody testing, and that's sort of what it's going to take to get us back and open again. How does that, I mean, I guess looking at what you folks are doing, what is the difference? Because obviously I think there's this perception that if you have the antibodies, you're probably going to be okay. You've already had it, but that's not technically what you're, how does that correlate together with what you're studying?
Dr. Topham will answer that.
Yeah, so the antibody testing is really important because it tells us what the true infection rate has been. It'll give us a better idea of what the denominator truly is in terms of how many people are getting infected, how many people develop severe disease. It's also, particularly for people such as healthcare workers, I think it would be important for them to know whether or not they've been infected and whether they have a degree of protection because of that they've become immune. Having said that, there is still some, we don't know very much about how well infection results in protective immunity. You can get reinfected with coronaviruses, the regular seasonal ones. And so it's possible that you might be protected for a short time after this COVID infection, but we don't know how long that lasts. That's part of the objectives of the study, is to find out how long those protective antibodies persist.
Thanks, Jennifer. We're going to try again Diana Louise Carter from the RBJ.
All right, so she typed in this.
Oh, she's typed a question. How will you recruit local people for the study, and are you already doing that? That'd be for Dr. Branche, I think.
So we hope to roll out the study this week. We've been working with our media team here at the University of Rochester to spread the word within the community. We will, of course, be recruiting within the hospital system itself, patients we know who have tested positive, patients who may be hospitalized, healthcare workers who are suspected to have or confirmed to have an infection. But we really also want to recruit more widely within the community. So you can expect to see Facebook pages, Instagram ads, potentially things in local newspapers, and even being able to speak to you guys helps get the word out that we're interested in studying COVID-19 infections, and hopefully people in the community will want to contribute to the science.
Diana, did you have a follow-up? I think we'll just keep things moving along. Type in a follow-up if you've got it. Spectrum News, Mary McCombs, I think I saw is on the line.
Yes, good afternoon. Thanks for being available for us and taking our questions today. We understand that this is such a new virus and so little is known. Now, I know you're doing the study searching for answers because you need the answers, or is this based more on existing data that you're seeing in other countries, for example, China, where we're hearing about cases of reinfection?
Yeah, so I would say, no, this is new information. I have been involved in various global teleconferences talking about the kind of research that's going on, and have actually heard very little about anybody studying acutely infected subjects, in particular looking at their immune responses. I don't know why this is, if they're hard to get or if when they're sick they don't want to participate in the study, but there isn't a lot of information out there to go on in terms of what is happening to the immune system during these infections. There's some anecdotal information, but as you know, we need to do controlled studies where we know all the conditions that affect the responses.
And something else to remember is that our first case here on U.S. soil is only about 3 months old. And so this would be around the time when we would start to really wonder what kind of antibody response do you have now and how much longer will it last? And so this is very much an evolving area of research. For us here in Rochester, our first cases are about a month old. And so one of the things that Dave and the rest of our team wants to do is to see, so do you develop antibodies after the first month? Do the antibodies last for 2, 3, 6 months, a year? what is the breadth of that protection? And the other thing that we do really well here at the University of Rochester is not just look at antibodies, but lots of different kinds of immune responses. And all of these will ultimately inform vaccine development.
Quick follow-up. When you say follow clinically, do you mean follow with blood tests or positive swab tests? I mean, is the end result evidence of clinical disease, or are we, do you know what I'm saying?
So I'll speak to one of those things. So we certainly do want to understand clinical disease. So we will be swabbing people consecutively for over several weeks and up to a month. I think that's something we can add to what is known about COVID-19, specifically how long are patients shedding virus and how long are they infectious, and what are the difference between people who are infectious for shorter periods of time versus those who are infectious for longer periods of time. Is it just about the person and the host, or is there something else specific that's going on? So that part we certainly hope to help contribute to, and Dave can talk about sort of understanding the immune response.
Yeah, and I was going to say, following on the previous question, that another study that we're doing that's it's separate from this acute infection study is to look at blood samples that we collected from healthy people prior to the pandemic to try to see if there's in certain age groups or certain segments of the population, whether there's pre-existing immunity that cross-reacts with the new virus. And that may explain why some people have milder cases than others. Because it's such a new virus, it's also possible there is no cross-reactive immunity, but if we can find evidence that there is, again, that's very useful information for public health coordinators and policymakers.
Next, we're going to go to Gary Craig, who's on the line from the Democrat and Chronicle, and then City Newspaper will be after that. Gary?
Okay, can you hear me?
Just fine,
Yeah.
thank you.
Yeah. Oh, so just, I know you've talked about, I guess, in the news release and here at the outset, the idea of following the COVID-19 patients for a few months. Does that, I mean, I wonder if there is a firm end time, or does that give you enough data to sort of know what you're looking for, or will it just be expanded as it's going along?
Well, the study that we're doing was based on a pre-existing protocol designed to look at influenza. And so we're using that study design for this study. There isn't any reason why we can't call the subjects back in. So the current study that we're doing will go out to 90 days, but there isn't any reason why we can't call them back in at 6 months or a year to come in and give another blood sample that we can test. We have other protocols we can use for that. And if it turns out that we don't see waning immunity at 90 days, we may want to find out what's happening at 6 months and a year.
And just one follow-up, and I'll be done. On a different subject, I mean, you mentioned that for whatever reason, there doesn't seem to have been, you know, the window is narrow, but seem to have been studies of this sort from what you're hearing about, even talking globally. And you mentioned the possibility that maybe some folks just aren't up to it, some of the COVID-19. I mean, do you have a sense of what it's going to take to make sure you have participants, or do you have a concern about that, or do you feel pretty good about getting the people you need?
You know, I'll start an answer and say that it's a lot easier to say that we're going to enroll these subjects. It's actually a lot harder to do. And I think Angela can talk to that. It's sometimes difficult to recruit the exact kind of subjects that we want or need.
I don't know what's going to happen, to be perfectly honest. I think that one thing about Rochester is that we've been studying respiratory viruses for decades. And people are used to us in Rochester asking them to participate and to sort of lend, you know, their blood samples or their nasal samples to science. So I expect we will have quite a lot of interest. We've done similar studies for flu in the fall and in the winter, and we sometimes get up to 100 responses a day. We've already had people calling healthcare workers and other people in the community. Patient 1 here in Rochester actually called us and said, can you use me in some way? Can you use my blood? Can I do something to contribute to helping to understand COVID-19? And I think that just speaks to the community and to our ties with the community. So I don't know if we'll get the numbers that we're interested in getting, but you know what? If we find 10 COVID-19 patients, And we're able to do this extensive assessment of the immune response. That will contribute greatly, I think, to what our understanding is of this disease.
Before we move to City, Diana Levy-Carter had kind of a yes/no follow-up from the Rochester Business Journal. So you're recruiting both people who have been infected, people who have been exposed but have no symptoms, and are there any other groups that you're recruiting?
So people who have been infected, we're certainly interested in that, even if your infection was as far back as a month ago. We're looking for people who are currently infected and known to be infected. We're looking for people who are suspicious that they might have an infection, but they haven't had a chance to get tested yet. We'll test you here in our clinic. And we're also looking for people who've been exposed, living in a household with someone known to be positive.
Thank you, Dr. Branche. And now we'll go to City Newspaper. And Jeremy, I'm going to embarrass myself. I don't know how to say your last name. Jeremy.
Oh. There we go. It's Mole. Thanks. You earlier, I believe Chip had mentioned that this study could play a role in helping officials as they sort of reopen society. How does that? Could you just walk me through how that works?
I think in a couple of different ways. One, the study will allow us to characterize and recognize a COVID-specific immune response. So what does that look like? How can we measure it? And then again, pairing that with something like a seroprevalence study where you test people who may or may not have been infected to try to find out if they have antibodies to the virus. That gives us an idea of, again, how many people were infected in a community. Have you reached a level of population immunity where you feel more comfortable opening things back up again? There's a phenomenon with virus infections called herd immunity. And once enough of a population is infected and immune, the chances that the virus will spread is diminished simply because there are fewer targets for the virus to latch onto. So again, we need to know that information before we can decide. If, on the other hand, it turns out that very few people are immune in a given community or show any evidence of being exposed to the virus, then even if the number of cases in coming to the hospital go down, there's still a concern that you've got a lot of non-immune people walking around out there that if you open things back up again, the epidemic could blow up again.
Do you have a follow-up, Jeremy?
I think I'm set. Thanks.
Thank you. And next, WXXI, Alex Creighton is on the line.
Oh. Hello, I'm filling in for a colleague at the last second, so I really wasn't prepared with any questions. I guess the one thing I was wondering about is, people need to get this virus so they can develop some immunity to it, right? But this virus can also be very deadly. I mean, how do you deal with that dichotomy, I guess?
I think, this is why we're also going to be working on developing a vaccine or vaccines for this virus, because eventually if we can vaccinate people, that would be a much safer way for them to acquire immunity against the virus than waiting around to get infected.
And Alex, since you weren't ready, the PR guy will ask your follow-up, and on your Zoom screen, you'll see a slow pitch softball coming across your screen. Why was Rochester picked for this study? Why would Rochester be a good place to do this research?
I think Rochester was picked for a number of reasons. So NIH specifically asked us to do this study using our existing protocols. And the reason they did that is it's much faster to take an existing human subjects protocol for research and modify it slightly to work on a different pathogen. If you had to start from scratch, writing the protocol, getting it approved, putting the infrastructure in place takes much longer. We're ready to go. We have the infrastructure. We've been doing the studies. As Angela mentioned, we do annual acute influenza studies every year. In fact, we just completed this year's influenza surveillance study. And so we can move much faster than most other places. And plus we have a long history of doing respiratory virus research, and in particular studying human immune responses to those infections, as well as experimental vaccinations.
Thank you very much, Dr. Topham. Next, I see 13 Wham on. I don't know if there's a reporter on the line or if you're just running tape on this.
Yes, hi, this is Tyler Brown with 13
Tyler.
Wham. Yes, thank you guys so much for taking the time to answer our questions today. I was just wondering, do you guys happen to have a timeline of when you guys will be, first off, starting this research and how long it's going to take before we get the answers that we are looking for?
So we're starting right away. We hope to start recruiting subjects who have previously been infected and now in their convalescent period this week into next week. And then acutely infected subjects, we will hope to start to recruit next week. How long will we get an answer? Well, we're going to be learning things in real time. We'll be learning things about asymptomatic carriage, about people who have antibodies who didn't know they were infected in real time. We'll be learning about transmission within households in real time. But our ultimate question, which is how durable and the breadth of the immune response, the protective response that you develop after infection, that's going to take several months for us to understand. I think just about the time when we have some real good vaccine candidates, we'll have some good answers about immunity after natural infection to compare against responses to vaccine.
Which is going to be really important to know. I'll add that, my lab has been working already for a month developing the assays and reagents and whatnot that we're going to need in order to do these studies so that when the samples become available, we can start assaying them right away.
So it's a fast track. Tyler, did you have a follow-up question?
Yeah, my follow-up question is in terms of how many tests do you guys have? Do you guys have enough tests in case those cases you mentioned where people think they may be or suspected to may have contracted the virus, but in case they are tested negative, are there plenty of tests available in case a lot of that is the case, in case there's a lot of people that think they have the virus but potentially don't after they're tested?
Yeah, my lab and several other research labs here at the University of Rochester are capable of doing quite a lot of testing. We're trying our best not to overburden the clinical laboratory system. So we've all worked really hard to develop the ability to do the test in our own research labs. And I think that will help us have a pretty wide capacity.
Yeah, I'll add that the antibody testing that we'll be doing is really more for research purposes. I think what the country really needs is an FDA-approved and reliable, reproducible test. And there are many companies and individuals working on those tests, including some here in Rochester. In fact, Ortho Diagnostics was the first company to put out an FDA-approved test kit for antibodies to the virus. They're working on a rapid test kit right now. But those are the ones that are going to be needed to have official information that can be used to determine when to open things up again.
Thanks, Tyler. We're going to move to Channel 8, and then Will Astor from the Rochester Beacon. If anyone else wants to ask a question, I'll ask you to use chat to let us know if we've missed anybody. And I see Rory's name at Channel 8. I don't know if there's also a reporter on the line, but we're going to unmute Channel 8, WROC TV. Sorry, we're having trouble unmuting. Try Rory Plichia here. Rory right there. Okay, we're unmuting Rory Plichia. And you got to unmute yourselves. All right, well, that's Channel 8.
Christian's here.
Oh, here you go. Christian.
Hey, how you doing? Sorry, but I'm working in a basement. I'm sorry. I got these gorilla fingers on this phone. I'm sorry. So question for you, and I might have missed this, and I'm sorry. Will you guys be reporting directly to the governor's office on any findings? Because obviously people really want to get things opened back up again, and some of your research could be critical to that.
Governor Cuomo's office, I think, is.
No, we're not. We don't have plans and have not been asked to report directly to the governor's office.
Okay.
And did you have a follow-up, Christian?
Nope.
Okay.
Thank you.
Thanks. And Will Astor with Rochester Beacon.
Hi.
Hey.
Hello. what relation or any does this research have with clinical examinations of vaccines or antivirals? Is this information going to help target or identify those type of findings?
So yes, I think it definitely will. So just a little background. We know that after people have infections, they'll develop antibodies. There are several outstanding questions specific to that. How the magnitude of the antibody response, how long does it last? So just knowing that there are antibodies there doesn't really give you a good understanding as to how protective those antibodies are and how long that protection lasts. When we do vaccine studies, we measure the same things. We measure antibody responses to the vaccine that's given. So knowing what's happening with natural infection allows us to compare those results to what happens after vaccination. And the best vaccine will create the same sort of immune response that you get after natural infection, which you would expect to be protective for some period of time.
Yeah, one of the things Rochester's been has an advantage with is the fact that we do experimental vaccine studies as well as studies of natural infection. So having both of those pieces to compare, and we've been doing this for decades, is highly informative. So one informs the other, and we learn from doing these studies what to look for in the different situations, whether it's infection or vaccination.
And Will, did you have a follow-up?
Yeah, does this, is one of the things you're going to be looking at, there's some talk now about the mutability of the COVID-19 virus, and is that something you'll be looking at?
We'll certainly be sequencing the viruses that we collect. In terms of mutability, what I've been hearing so far is that while there are variants out there, there doesn't seem to be a lot of selection of those variants, so the mutations seem to be random at this point, which makes sense because there's no, for instance, immune pressure on the virus to mutate its antigens and escape immunity. What I expect to actually see more is mutations as the virus adapts further to human hosts so that it becomes more fit and probably more transmissible, or perhaps less.
And I realize we do have one more question from the media. Patty Singer from Minority Reporter. We're going to unmute you, and sorry I missed you before.
Yeah. Hi, thanks. So it sounds like from what Dr. Branche said that everybody is eligible for this study. Talk about people with an infection, people who think they were, people who've recovered. Is that, am I hearing that correctly?
Yeah, we want everyone to call us or reach out to us, and we'll do some discussion and some screening over the telephone. And I'm certain that there's as many people as have had an infection or recovering or suspect they have an infection. We can certainly find ways to utilize the data and the information they can give us to help research.
So again, I just want to be clear. So Mike Mendoza's talked about, asymptomatic people, and you talked about that transmission. So just to be clear, like it's almost open to everybody in the community.
Well, I think if, for example, you've been social distancing and you're in a home where nobody's been infected and you don't know of any known exposures, then the chances of you having an infection are maybe quite a bit lower. But you're right, they certainly could have had an asymptomatic infection. But I think that we'll be specifically asking screening questions and really trying to target people with a recovering from an infection, who are currently infected, or who know they've been exposed to someone with an infection.
And just if you get all middle-aged white males for your study, how would that maybe bias the results? How are you going to try to get out to all aspects of the community to make sure that you're getting a representative sample?
So we're doing our best to use every media platform that we can. Instagram and Facebook and other social medias that maybe a younger demographic might use. We'll also be reaching out to local newspapers. We'll be advertising here at the University of Rochester Medical Center. We'll be recruiting patients who are hospitalized and healthcare workers. And then, of course, speaking to you all and having it sort of be disseminated more widely on television really helps us to capture the demographic of Rochester. And as she said, not just a slice of that.
And Patty, I want to thank you very much for that question, because I should have pointed out that in our news release, we've got a link to a website where people can go today. And I'm going to ask Mark Michaud on our team to send back around to everybody, you know, maybe words that could go on a TV screen. So if people see your stories and are interested, we'd like them to start signing up now to let us know.
Is there a phone number, Chip, people can call?
There is 273-3990.
What's more?
273-3990.
The number again, 585-273-3990. So
operators are standing by. Call now.
I know we have to let Dr. Branche go to talk to NIAID, but I'm sure operators are. So thank you all again very much for participating in today's news briefing. If you have any follow-up questions, please email them to mediainquiries@urmc.rochester.edu, and Mark Michaud will send out a little more information about how people can sign up. Thanks, everybody.
Great, thank you.
Okay, thank you very much.